जय पंजाब, जय हिंद।
Triti C. Thomas.
Thank you, Chairman, for giving me an opportunity to participate in the discussion under Rule 193 on the problem of drug abuse in the country and the steps taken by the government. Sir, the WHO has declared drug addiction as a disease. It is a physical disease, mental disease, psychological disease, social disease, and a disease that affects the family also. This is a disease that has no recovery. Hence, the best way is to avoid the use of drugs. Sir, as was mentioned earlier in this House, 50% of India's population is below the age of 25 years. And drug addiction is found more among youngsters and students. According to Gary Lewis, the South Asia Regional Representative on UN Office on Drugs and Crime, the opinion that the drug abuse is exclusively urban phenomenon is a myth. Sir, injecting drugs and high-risk behaviors are seen in both urban as well as rural areas. The observation of 26th June as the International Day Against Drug Abuse and Illicit Trafficking alone is not sufficient to eradicate this menace. The entire world is facing the menace of drug addiction, which has a devastating impact on the addicted individual, family, and a large section of the society also. Sir, the launch of Nasha Mukta Bharat Abhiyan is a good endeavor. In this campaign, 272 districts across the country have been identified as the most vulnerable in terms of usage of drugs. During the last 3 decades, the Ministry of Social Justice and Empowerment has conducted 2 nationwide drug surveys. One was published in 2004, the other was published in 2019. The results of these surveys suggest that the drug use in India continues to grow unabated. According to the national survey conducted by the Ministry of Social Justice and Empowerment in 2019, there are more than 60 million drug users in the country, of which a large number of users are in the age group of 10 to 17 years. Let us join together to fight this menace. Sir, during the last, the results of these surveys suggest that drug use in India continues to grow unabated. More disturbingly, heroin has replaced the natural opioids as the most commonly used abused opioids. A large-scale epidemiological study from Punjab also concurred with this finding. The uses of other synthetic drugs and cocaine have also increased significantly. The National Mental Health Survey 2015-16 showed a treatment gap of more than one more minute. It has showed a treatment gap of more than 70% for drug use disorders. The recent nationwide survey on substance use disorders has replicated the result with a nearly 75% treatment gap for drug use disorders. Added to that misery, merely 5% of the people with illicit drug use disorders receive inpatient care. The large treatment gap indicates poor accessibility, utilization, quality of health care, etc. So, to meet this unattended need, the government should expand the treatment and rehabilitation facilities for substance use disorders. As drug demand reduction falls under the direct purview of both the Ministries of Health as well as Social Justice, Department of Social Justice, a coordinated and concerned effort is required to fill the treatment gap with a minimum standard. One more minute, sir. Standard of care. Sir, only 1 minute. Current and future challenges in the supply reduction lie in the early detection and scheduling of the new psychoactive substances. The recently published report on of the International Narcotic Control Board revealed India's threat to mephedrone and captamin. Sir, misuse of the over-the-counter medication with a definite or with possible addictive potential is another concern voiced by the International Forum. The biggest challenge remains to maintain a rehabilitative approach than a punitive one, even while punishing the addicts. Sir, it has to be well maintained that they are treated and not simply punished.
Thank you, sir.
தலைவர் அவர்களே,
wait, we will be called.
அவைத் தலைவர் அவர்களே வணக்கம். போதை பழக்கத்திற்கு அடிமையாதல்